Hi guys, welcome back to our channel. I'm so sorry we've taken a break for a while. Oh, we are back. We're back. Thank you guys for your engagement with other videos we've put out on this channel. Thank you for your comments, your like. We really do appreciate it. Thank you so much for coming back. So today we're going to continue with our topic on positioning. Today we're going to be looking at the cardiovascular system positioning. So we're starting up with abdominal aneurysm resection. So guys, if you haven't seen our word for the day, please you can go back to the channel and say it. Some of the words we have on today's video will be on our shorts. So you can make reference to the words you don't know their meaning on our shorts. Okay, so we're talking about abdominal aneurysm resection on today's series. How will a nurse position the patient after such procedure? After the surgery, we limit elevation of the head of the bed to 45 degrees to avoid flexion of the graft. It's very important that the graft is not tampered with. The client may be turned from side to side. Okay, so first the client will be placed on the bed and the bed will be elevated, not elevation of the head of the bed at 45 degrees. Okay, so the next one we're going to be looking at will be amputation of the lower extremity. During the first 24 hours after amputation, we elevate the foot of the bed. The residual limb is supported with a pillow, but not elevated because of the risk of flexion contraction to reduce edema. Now remember I told you at the beginning of this series that whatever you see highlighted in red, it therefore means that I'm trying to make emphasis on it, and it's very important for your exam questions or probably your English questions as well. So we consult with the primary healthcare provider as what position is prescribed for the client. So we position the client in a prone position twice a day for at least 20 to 30 minutes period to stretch muscle and also prevent flexion contraction of the hips. So this is very important. Now the next would be arterial vascular grafting of an extremity. What do we do for clients who had undergone arterial vascular grafting of one of their extremity? What would we do? We promote graft patency after the procedure by bed resting, usually to maintain for approximately 24 hours, and the affected extremity is kept straight. We keep the affected extremity straight. We promote rest for at least 24 hours. Next, we will limit movement and avoid flexion of the hip and knees. Like as you can see on the picture here, we avoid movement and flexion of the hip and knees. Okay, so we're looking at cardiac catheterization, pardon me. So for femoral vessels, cardiac catheterization that it's being done on the femoral vessel. If the femoral vessel was assessed for this procedure, the client is maintained on bed rest for 4 to 6 hours. Time for bed rest may vary depending on what the primary healthcare provider thinks or that the patient needs. Okay, and also if a vascular closure device was used, the client may be turned from side to side at interval. Okay, the affected extremity is left straight and the head of the bed is elevated no more than 30 degrees. The affected extremity, that means the extremity, the femoral, the extremity the procedure is done on is straight, is kept straight, and the head of the bed is elevated no more than 30 degrees. Some healthcare providers may prefer a lower head position or a flat position until hemostasis is adequately achieved. I'm sorry, we have a typo here. So for heart failure and pulmonary edema positioning, patient who has heart failure or pulmonary edema position, the client is placed upright. preferably with the legs dangling over the side of the bed to decrease venous return and lung congestion. We decrease venous return and lung congestion. Okay. Now, it's very important that we know that most often these clients would have like respiratory or cardiac disorder and should be positioned with the head of the bed elevated so they can breathe in. At least with the position they're sitting, it will help them, it will aid their breathing, and it will help them, the blood circulation as well. Peripheral arterial disease. For the peripheral artery disease, what we need to understand is that we need to follow the primary healthcare prescription on positioning. Why do we need to do this? Because swelling can prevent arterial blood flow. Clients may be advised to elevate their feet at rest, but they should not raise their legs above the level of the heart, because this will slow this. If they do this and at an extreme level, it will slow arterial blood flow. So it's important that they don't raise their legs above the level of the heart so as to maintain arterial blood flow to the extremities. Okay, some client may be advised to maintain a slightly dependent position to promote perfusion. For DVT, this is the word for the day for today, depending on when this video is published. So you can check our shorts again, like I said before. Deep vein thrombosis positioning. If the extremity is red, edematous, and painful, we give traditional heparin. Or sodium therapy may be initiated. Then bed rest with, I'm sure you know what heparin is, an anticoagulant. We give this as well to the patient. The bed rest with the leg elevation may be also prescribed for this client. Yes, we want to promote blood flow back to the heart, so it's very important that the leg of the patient is elevated. Client receives low molecular weight heparin, usually can be out of the bed for at least 24 hours if pain level permits. Yes, the client can walk around at least the first 24 hours if the client is not on so much pain. Now, let me pause for a second and ask us, do you know the difference between DVT and varicose vein? If you know the difference between DVT and varicose vein, please let me know in the comment section. So we're looking at another one, varicose vein. The leg elevation above the heart level usually is prescribed. Yes, the same with DVT. The client is also advised to minimize prolonged sitting or standing during activities. Yes, to reduce the pressure on the veins. Okay, look at how it looks. And also, we have venous insufficiency and leg ulcer. So how would you place client like this? Leg elevation is usually prescribed. So for DVT and varicose vein, leg elevation is very, very important. Now, this brings us to the end of today's quick series. So we're going to look at some NCLEX questions related to what we've just learned. So the first question will be, the nurse is preparing to care for a client who has returned to the nursing unit after cardiac catheterization performed through the femoral vessel. Do you remember this? I'm sure you heard this femoral vessel today. The nurse checks the primary healthcare provider prescription and plans to allow which client position of activity after the procedure. Whenever you're reading NCLEX questions, you should take note of, don't read quickly without understanding what they're asking you. Here, the question is asking you the positioning after the procedure. So let's look at the options given to us. Bed rest in high Fowler's position, bed rest with bathroom privileges only, bed rest with head elevation at 60 degrees, bed rest with head elevation no greater than 30 degrees. Dun, 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 dun. What's your answer? What did you pick? The answer is D. After cardiac catheterization, the extremity into which the catheter was inserted is kept for 4 to 6 hours. The client is maintained on bed rest for 4 to 6 hours. time for bed rest may vary depending on what the primary healthcare provider preference is, or what he or she thinks the client needs, on whether a vascular closure device was used, or whether a vascular closure device was used, like I mentioned during the lecture time, and the client may turn from side to side. The head is elevated no more than 30 degrees, although some primary healthcare providers prefer lower or flat position until hemostasis is adequately achieved. Like I said before, I hope you got this. If you didn't get this, you should go back and listen to the slide again and make sure you get it. The next question will be, the nurse creates a plan of care for a client with DVT, deep vein thrombosis. Which client position or activity in the plan should be included? What should you include in the plan of a client with DVT? Out of bed activities as desired, bed rest with the affected extremity kept flat, bed rest with elevation of the affected extremity, bed rest with affected extremity in a dependent position. Bum, 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 bum. What's your answer? Answer is C, okay? For the client with DVT, elevation of the affected leg facilitates blood flow by the force of gravity and decreases venous pressure. Yes, that's why the client shouldn't be standing for a long time or sitting for a long time to decrease the pressure, which in turn relieves edema and pain. A flat or dependent position of the leg would not achieve this goal. Okay? Bed rest is indicated to prevent emboli. This is very risky. This is an emergency, and to prevent pressure fluctuation in the venous system that occurs with working. Now, guys, this brings us to the end of today's series on cardiovascular system positioning. I will see you in my next video. Bye. I'll see you guys in my next video. Thank you so much for joining today. Bye-bye.